generally the anatomy of the lower limb is a piece of cake comparing to all these things which we have survived so far. So muscles are big, vessels are big, everything is big and visible. See now, this is the tibialis anterior muscle. The tibialis anterior is immediately next to tibia, so we are watching tibia first, and then immediately next to it, there is a tendon of the tibialis anterior muscle. See, when it's attached here to the navicular bone, it probably can also dorsiflex. So when it contracts, it dorsiflexes, but depending on the position of the foot, it may elevate the medial border or elevate the lateral border of the foot. So it's same inverter and everter. Eversion is the elevation of the lateral border of foot. Inversion is the elevation of the medial border of foot. Now, I think that tendon of the extensor hallucis longus is easy to see. And see that normally this muscle is almost invisible here, but certainly we should find it as well. It's the tendon of the extensor hallucis longus. And the lateral muscle here. Oh, where are you? Over here. Don't be shy. And here we have got the tendons of the extensor digitorum longus. Extensor digitorum longus. And see, the most lateral part of extensor digitorum longus, see, it forms a separate tendon and separate belly, and it goes to the tuberosity of the fifth metatarsal bone. This is this fibularis tertius. This one is very nice. Well, good to mark. Okay, now see how deep are the vessels here and nerve. The vessels and nerve, well, right here, see, the nerve is quite thin and the vessels are relatively deep. They are over here. See, these are the vessels. Anterior tibial vessels plus the deep fibular nerve. Anterior tibial plus deep fibular. They are running here between tibialis anterior and then extensor hallucis longus. First, on top, they run between extensor digitorum longus, but later a little bit more. And actually, we should find the small branch because this deep fibular, it innervates skin of the adjacent surface of the big and second toe. Just this space is the only supplied by the deep fibular nerve, I mean the cutaneous innervation. Entire anterior group is just the deep fibular. How about the lateral group? Lateral muscles, this is the fibularis longus, and below it's the fibularis brevis. Well, difficult to say. This is longus because its tendon is long. This is brevis because its tendon is short. Brevis, let me remind, it's just a short. How should we find the superficial fibular nerve? Actually, in this limb, it will be quite difficult because this nerve is the nerve which exits between the lateral and anterior group. When you have a nerve, because sometimes in a cadaver, especially on the practical exam, when this nerve is checked by, let's say, 20 persons, so the 21st person has really huge problems to say which of these nerves it is. In fact, is it superficial or deep? But we should always watch which group of the muscles it is. If this is a nerve which is between muscles of the anterior group, this is absolutely deep fibular. When it exits between lateral and anterior, then it is the superficial. Never watch actually the depth of the course. Of course, in the patient, yes, that's right. But in the cadaver during the exam, technically, you can expect that some structures, especially when they are tested several times, they may change their positions.